It's an honor to receive this prestigious award to empower our communities and recognize our efforts as a team to communicate and engage with our local community. And I would like to offer this award to the whole team who worked hard to manage and develop a Jewar application. Thank you.
So our strategy in the Red Sea Global and especially in the social development to create a sustainable and long-lasting communication methodology with the community. So when we created Jewar application, we intended to have a two-way communication with the local community, listening to them, not only providing them with the updates and news and jobs that we are offering in the destination, but also listening to their feedbacks, their reactions. They can rate and comment on the programs that we're receiving. From that, we collect the data and we are now developing a phase 2 enhancement for Jewar application based on our observation when we utilized and used the application, and also from the feedback that we received from the local community. One of the main strategy pillar, creating partnership with different stakeholders internally and externally. So when we talk about the external stakeholders, we're talking about government entities, private sectors, non-profit organizations. We did a collaboration with all of them in different projects and programs, not only getting the permits from them, but also delivering their objectives through Jewar. Jewar gives the entities the outreach and we can maximize the outreach for the, for example, the government entities or the NPOs. Also, they benefit from, for example, the NPOs when they partner with the Red Sea in Jewar. It gives the community the credit that they are active in the community and they can deliver and scale up their programs and projects.
Establishing a medical services strategy alongside a robust emergency response operation at a remote location presented Red Sea Global with several challenges, really. Remote locations often have very limited access to transportation. This complicated our plans for delivery of supplies, equipment, and even personnel. In the early days, we lacked essential infrastructure such as reliable communication systems, and even safe access by road was a challenge. We had to consider how we would bring in medical supplies, equipment, and personnel. And we worked with our partner, International SOS, to come up with a recruitment plan and how we were going to attract and retain qualified medical staff, especially within an environment like this. In any remote area, really, you have to consider isolation. It wasn't a place where you're going to bring your family along. So we had to consider the local community also. And gradually, we're going to be introducing 75,000 workers into an existing area, and that can raise concerns, especially with the local community. So we had to build relationships with the local community, and that was essential. Medical infrastructure had to be capable and sufficient enough in order to prevent us from adding any additional burden onto the local medical infrastructure as well. And one other area was the environment itself. So how would this affect precise medical equipment? What terrain would we need to traverse in order to respond to a medical emergency? And we knew however good we could be, we would need to establish relationships with local government agencies and local healthcare providers. In a remote location, you need clear communication, and frameworks are necessary so you're able to meet those challenges. One of the first actions was to establish good internet and communication technologies so we could collect and manage data, especially medical history. And this is critical for tracking health trends and managing emergencies effectively. So depending on where you are and what you're working with, you may be dealing with different regulatory frameworks. And this can be complicated. There's potential liabilities, and the practice of medicine itself is different compared to urban settings. So we worked with our government relations team here in the Kingdom to ensure that all local rules and regulations were followed. And finally, we had to plan our medical strategy not only for now, but for the future. We would soon be having more employees and their families, and especially guests as well. So until a permanent medical facility was built, our temporary medical infrastructure and services would have to deal with an expanding and often demanding population. So one of the first things any travel company needs to do when building or strengthening their emergency response frameworks is to understand the environment that they're going to operate within. And this includes the local topography, ground conditions, transport infrastructure, roads, and what already exists in terms of local medical facilities. Then you should work to establish and foster strong partnerships with local authorities, specialised medical service providers, and rescue organisations also. And these collaborations can enhance coordination, resource sharing, and overall effectiveness of the emergency response. And this leads to more efficient and comprehensive care for the guests. You have to develop clear communication channels and protocols for coordinating between medical facilities, emergency teams, and other stakeholders. Effective communication ensures that all parties are aligned and can act swiftly and cohesively during crises. And you must practice regular training. Regular training and drills are essential. We conduct regular training sessions and emergency drills for our response teams to ensure that we're prepared and we can identify any potential system gaps. Frequent exercises also help personnel stay familiar with procedures and protocols, which is essential for a rapid and effective response. You also have to provide travellers with information about safety procedures and emergency contacts, preferably before their trip. Clear instructions and support can help them stay calm and follow protocols in the event of an emergency. And it also provides them with confidence that their hosts are able and ready and prepared to manage any emergency eventualities. Finally, establish and maintain an effective, dedicated crisis management team who will be responsible for coordinating response efforts and making critical decisions. These teams should comprise of individuals with expertise in emergency management, logistics, and communication.